Kia ora, tēnā koe, fi Jamieson-Folland, the lifestyle aligner with can getting better sleep help our heart health? Great question, and I can imagine that you suspect that it can. And I speak into that in this week's blog, and I write into that in this week's blog, and speaking about it today, obviously, in the vlog. And so a couple of things, I'm going to scour through the blog so that I can pull out salient points for you that I really recommend. If you would like to access that blog and you aren't yet, let me know, because there's some really useful info in here, including sleep hygiene tips. So it's been shown, research is showing that improving our sleep quality can actually help reduce the risk of heart disease and other cardiovascular issues. And in this sleep time, we also know that our body repairs itself, and this includes our cardiovascular system, cardiovascular sleeping. And so when it comes to how much do we need, for between 7 and 9 hours for adults, and considerably more as we get young, for those who are younger than adult. And it's really important that it's uninterrupted. So some studies were done when they interrupted the sleep versus when that sleep was consistent all the way through. Obviously having a comfy bed makes a big difference, and I'll talk about some sleep hygiene specifics. So making sure that we're getting to bed and having a routine around sleep. So when we go to sleep and when we wake up, avoiding caffeine, alcohol, screen time, devices, TV, bright lights, so starting to dim those, eating quite late or eating closer to bedtime, allowing at least 2 hours so that we can digest our food before we go to sleep. Nicotine, that can be linked to not being able to sleep so well. And making sure it's a dark, quiet and cool environment to sleep in. I'm actually been trialing using eye patches, and they've been fantastic. So another key that we found has been found to help us sleep is eating a healthy diet and supplementing with vitamins and minerals that can particularly help our heart health. What else did I want to say here? The other thing is balanced diet that's low in saturated and trans fats, high in lean proteins, fruits and veggies can also help our healthy heart, which we covered, I think, in a previous blog. So exercise seems to be another factor to help improve our quality of our sleep. And how much are we talking about? We're talking about 30 minutes of moderate exercise, moderate to intensity exercise. We're not sort of wandering along, being able to have a full-blown conversation with a friend. We're kind of hoofing along, speaking a bit more tricky. So best position, it seems to be on the left side, although finding the best position for you is paramount here. But what this can help do is better blood flow and reduces the risk of heartburn and acid reflux, which can be irritating to our heart and blood vessels. And the other thing too is that it can cause problems with our cortisol levels, our stress hormone, and that can mess up other hormone levels, but it can impact the function of our cardiovascular system, including our blood pressure. When it comes to regulating our metabolism and allowing us to maintain a healthy weight, sleep is key in this process as well, and really helping to improve our body's efficiency with having an optimal metabolism for us. Carrying too much weight, as it's kind of widely known, can lead to an increased risk of heart attack and stroke. So the other thing, one real key here, is the impact of not having as much sleep can cause more inflammation in the body, which can be linked to cardiovascular disease. So people who get enough sleep have lower levels of C-reactive protein, or CRP, which can be a marker for inflammation. Can impact our mental health, having us feel better, less moody when we get out there. You probably noticed that as much as I have, for me personally. And also, that whole stress cycle has an impact in everything, including our heart health. Any other sleep tips I can recommend here? I think we covered most of them actually. But that routine, getting that ideal routine for you for sleeping is top of the list. So if you've got any questions around sleeping in relation to heart health, or challenges with heart health, challenges with sleeping, then please do reach out. It's always fantastic to hear from you. And I'll see you on this week's Alive with Fee. Ciao.